Welcome to Session 4 of Module 1, entitled World Health Organization Resources on FGM Prevention and Care. The objectives of this module is to be aware of the available WHO resources that can support you in your area of work. The presentation would cover the existing WHO resources, and in the end we'll share with you upcoming ones. And for those that we have at the moment, we will describe the background, the rationale for this resource, what it's about, a brief overview of its content, its target audience, and an e-link to access the resource for further reading. So we do have a lot of WHO resources on FGM. Let's start with the FGM cost calculator. We developed this resource because there was limited involvement of the health sector in FGM prevention, and we know that the health complications do have a health cost, and that the burden, if we measure the burden of these health costs, it could be a powerful incentive to take action. However, there's no evidence, or there's limited evidence on the impact of health complications cost-wise, and how FGM abandonment efforts can alleviate these costs. So what is this FGM cost calculator? It's an interactive online tool to visualize the costs associated with health complications of FGM over a woman's lifetime. So you'd see the amount of money that could be saved in different scenarios of abandonment over time in 27 countries that have high FGM prevalence. So this is what you would find once you click the link that I shared in the previous slide, the white part of this slide here. This is the cost calculator page. You would find the home, the cost calculator tab. This is what's currently clicked at. The fact sheets, I'll describe them later, instructions, and something about the cost calculator. So basically you'd enter the country you're interested to get the data from, and you calculate. At the fact sheet tab, there's very nice printouts for the country, explaining the cases, or rather graphs indicating the increase of cases over time, and the health costs implications, and what it means if there are if there is a full abandonment versus a partial abandonment, or doing business as usual scenarios, to see the impact on the number of cases as well as the costs. The green section of the fact sheet, you would see the health complications across the life course, from childhood, adulthood, reproductive, and later ages, and you would see the types of complications along this the life course, and some key messages to highlight that has no health benefits, and really calls for action to invest in FGM and its abandonment. This fact sheet, is very useful. It could be printed out and shared to decision makers, your target audience, so that they could be sensitized to the impact of FGM on health expenditure, and such as ministers or donors, and really makes a call for investment in designing policies, strategies, plans, and programs. And this, this fact sheet does not have to be, you could use it even as a clinician. If you want to instill some changes in your clinic, you could show that in your country that it's really very costly, and the best ways to prevent it. So it's not necessarily only at national level, it could also be used at subnational and even at facility level to convince those who make decisions to invest more in services and taking care of to prevent FGM. Moving on to the next WHO resource entitled Person-Centered Communication for FGM Prevention, a Facilitator Guide. This resource was recently published in 2022, and it really was driven because healthcare providers do not, lack the knowledge and the skills, or even to communicate effectively on FGM, specifically on FGM prevention. And that sort of like follows well from the first slide where we encourage investment into FGM prevention. There's a need to build the skills of health workers to be more effective in FGM prevention. However, there was no evidence-based resources to strengthen these skills. So what is this resource? It's an evidence-based resource that was tested in 3 countries, namely Kenya, Somalia, and Guinea, where FGM is quite prevalent. And this training guide uses several interactive training methods, such as storytelling, like the one I showed in session 2, regarding the land, the tradition, that story of the land, Zamba land. And there are also animated videos, role plays, discussion. It's really a very interactive adult-based learning, and could be conducted in a 3-day participatory workshop, ideally for 16 to 20 participants. As we mentioned earlier, if you're going to discuss beliefs and values, they're quite, heavy areas to discuss and take time. And but this content could be adapted based on the specific needs and the context. As you can see in the link below, this is where you can access the guide and its other resources. So there's an animated video and several handouts that are very helpful for these resources. And briefly, it's made up of 9 sessions, and it focuses on traditions, values, sensitizing the healthcare providers on their roles, what person-centered communication means, and what beliefs mean, and how to conduct person-centered communication for FGM prevention, and a session on values and ethics on FGM medicalization. As you can see, there are several training aids, and each of these training aids are colored according to each session. So you could see here in red, training aid is for session 2, and for 3 and 5 and 6. 6, they're in yellow. And the target audience of this facilitator guide is any trainer, really, any health professional trainer who's responsible to train midwives and nurses primarily. We selected them because as the main target of this training guide, but it could be adapted to any other health professional out there. Moving on to guidelines, we have a WHO guidelines on the management of health complications from FGM. It was published in 2016, and we are currently updating it. And this really has a set of recommendations on how to manage health complications that are associated or caused by FGM. And not only is it just a guideline, but its content can actually be used for developing job aids, for developing content for training, professional training, whether it's in pre or in-service training. And these are the documents related to the guidelines. We have the guideline itself, the WHO guidelines. We have a summary, an executive summary for this guideline. If you do not want to read all of its content, there is a summarized version as well as a policy brief. Please visit this link if you would like to read some more on it. A brief overview. The guideline is organized around 4 domains: de-infibulation, as you can see in blue, mental health, female sexual health, and information and education. There are 5 recommendations, as you can see, R1 to R5, and there are 8 good practice statements, BP. And recommendations are those that are supported with evidence, strong evidence, whilst good practices do not have sufficient evidence to make them a recommendation. The target audience of these guidelines are mainly healthcare providers, clinicians like you, but it also includes, as I mentioned, content that could be used for planning, for developing protocols, policies, and training content. Another resource we have is entitled The Care of Girls and Women Living with FGM, a clinical handbook, and this was produced 2 years after the guideline. It's really a derivative of the guideline itself, and it's a user-friendly handbook, what we call like a pocket book, but it's not really small, but it provides step-by-step guidance on how to provide comprehensive care to the different domains we've talked about, and how to effectively communicate and care using a person and family-centered approach. As you can see in the bottom of the slide, there's the link to read some more on it. Briefly, if you do download it, and we recommend that you do, it's organized around 9 chapters. The first one, understanding the female genital mutilation, the second on communication, the third on its short-term complications, the fourth on the gynecological and urogynecological care, whilst the fifth is how to care during pregnancy, labor, childbirth, and postpartum. The sixth, a big space to how to perform de-infibulation correctly. The seventh is on mental health, while the eighth is on sexual health and FGM. The ninth chapter is a set of additional considerations. So this, as you could see, is a clinical handbook, and it's really targeting providers who are caring for girls and women who have undergone FGM. Okay, so we have several resources, educational resources on FGM, such as the one you could see here, integrating FGM prevention and management of complications into curricula of nurses and midwives. We have 2 versions, a teacher's and a student guide, and this is quite specific to midwives and nurses, but as I mentioned again, it could be modified to any other healthcare providers. It aims to build the knowledge and skills to prevent and manage FGM, as well as guide on strategies on how to involve individuals, families, and political leaders in FGM prevention, as well as to manage and care for women living with FGM during pregnancy, childbirth, and postpartum periods. So if you can recall, the clinical handbook is a 2018 publication, and we would recommend that that should be the reference because it has been updated to the most recent literature then. And probably this resource would be useful for looking up strategies on how to involve families, communities, and political leaders in FGM prevention. So just a brief overview of how it looks like if you open the document. It has 4 modules. Introduction, just like the clinical handbook, but this module might be of interest, especially for community health aspects, outreach aspects, and how to involve individuals and community members. As I mentioned earlier, the management component of girls with complications is updated in the 2018 clinical handbook. And both these publications, their target, as there is a teacher's guide and a student's manual, it targets teachers as well as students in the health professional who are health professionals or becoming health professionals. So this more recent guide on education 2022 publication entitled Integrating Female Genital Mutilation Content into Nursing and Midwifery Curricula is a guide that helpful to develop context-specific or FGM training content that meets the situation and the needs of the healthcare providers, and it also guides on how best to integrate the training content within existing training curricula. Here we target the curriculum planners, educators at all levels, so that you don't get confused. The earlier versions, the 2001, was really about content, but this one, it guides you on how to develop the content. You just can't copy and paste content, but it's really to think strategically on the content and how best to integrate it into a curricula. So it uses this step-by-step approach, a 1, 2, 3 step approach that helps you figure out, how to get the curriculum, group arranged, and how do you develop the content and where you integrate it or not, depending on, the feasibility, and how to pilot test it and as well as evaluate it. Another also key aspect of this practical guide is that it does give you clear learning outcomes. And there are 6. So it's about building the knowledge about that's relevant to the contextual setting, understanding own values and attitudes, understanding the legal accountability measures, the healthcare providers, the roles, how to manage FGM complications depending on the professional competency, and how to provide a person-centered communication. So let's change the gears a bit and move to a resource that is helpful for research. There is a growing body of research on FGM, and in fact, if you can see in this document here, there's a global research agenda on priority health areas to be researched. So, and we know that FGM is a sensitive research topic and can bring risks to both participants and researchers throughout the stages of research. So we developed this guidance to strengthen the ethical conduct of all research on FGM. And it highlights the key ethical considerations that are faced by researchers the guidance so that you could maximize the impact and the quality of research on FGM, as well as minimize the risks for participants. And also, as a bonus, provides guidance for all kinds of studies on FGM. And again, this is the link where you can access the resource. And this is how the ethical guidance looks like from inside. We have 5 chapters. First being on the introduction, the second an overview of the ethical principles, and then the third really goes into study designs, and fourth on the study implementation, analysis and dissemination. So really the ethical aspects throughout the whole cycle of research. So we have just talked about research, and now we move on to another WHO resource, and it's the title of this research is the Global Strategy to Stop Healthcare Providers from Performing FGM. And this resource was developed because there is an increasing trend of FGM medicalization. And there's a lot of global health community movement to address this, and they needed a strategic approach to do so. So it's really a guidance document to strategically address FGM medicalization through the 4 pillars of action. In fact, these 4 pillars of action could be extended to not just FGM medicalization, but also to overall the the health sector response to address FGM. And the target audience of this strategy is starts from policymakers, parliamentarians, professional associations, healthcare providers, down to clinicians. Anybody who wants to do something about FGM could use these 4 pillars to address it. Again, there's a link here below that you can access to download the document. And this is what it looks like from inside. It's 4 chapters, and it goes over, part 1 covers the terminologies and the burden of FGM and its medicalization, while part 2 relates to the global goals and the concerns around FGM medicalization. Part 3 explains why FGM medicalization happens. And I think this was covered in session 1 about the drivers of FGM medicalization, and it also explains why it should not happen and what are the challenges that need to be overcome to stop it. And part 4, which I think is quite key here, and as participants request you to read some more on, is these 4 strategic pillars of action that have activities that could be relevant to your own practice. So still moving on to sort of like commitments and strategic thinking, we have this statement, an interagency statement that was issued in 2008 because more and more UN agencies were getting involved and wanted to show commitment and call for action. This statement was issued to support advocacy, to highlight the human rights and legal dimensions of the problem, and to also share new evidence and lessons learned over the past decade. So this is how it looks from inside, and really the target audience here is everybody. It's national governments, international civil society, and communities, so that they could uphold the rights of girls and women. And it also makes a call for program implementers and communities to develop and strengthen and support specific and concrete actions. This is another resource that is quite useful if you would like to develop policies, whether they're at national level, subnational level, or at facility level, with specifically to areas on de-infibulation, re-infibulation, on FGM medicalization, and also to guide health workers for the importance of documenting FGM, and also at ministries of health for the need of including it in health information systems. When you click on the link, this is what you find is a table of contents. The first part, it's really just a list of 5 policies regarding infibulation, re-infibulation, documentation of FGM, and prevention of FGM by nurses, midwives, and other health professions. Policy 3 was really a historical. As you could see, this document was made in 2001, and this is when midwives were not trained on how to perform defibulation and re-infibulation. It's really a protective mechanism to show that the ministries or health facility has a policy for the health workers to perform this type of procedure. So it's really a very important step. If it's not part of routine or it's newly introduced into a facility, it's very important to have policies in place. And again, this document is useful for those who develop policies or directing practices of nurses, at health facility at national level. And it's also important for educators and facilitators to highlight and share as they train nurses and midwives once these policies are in place. There are a lot of information, education, and communication materials and infographics produced by WHO. I've just done a screenshot of what I can really capture over the screen. But if you visit the multimedia, you would actually, you could see them in a more clarity. But there are several animated videos. There are several, messages that, infographics that you could use to sensitize for advocacy. And if you recall, we had this myths exercise in session 2. And these are very nice cards that could be used in group exercises to check in whether it's true or false. And there are several printouts on how to, visually record FGM, how to manage problem management in 5 steps, how the external genitalia look like, how to correctly perform the defibulation procedure, and so on and so on. So there's so many resources. Please feel free, look at them. You could always download them, put them on your walls, use them for education purposes, to use them as reminders. For example, defibulation procedures, how to go step by step. So many uses in that. And finally, I just wanted to also bring to your attention this resource kit. It's an online resource. It's really a compendium of all the resources that I've shared with you. They've all being brought together in this page, which you can access here through this link. And they're all categorized into 6 areas under planning, training, education, clinical care, monitoring, evaluation, advocacy, and research. So whatever your area is and whatever you want to access, you can just click on the tab. For example, if I clicked on the clinical care part of it, this is what I will see. It will show that there are 3 tools available that I can use for clinical care. We've talked about the clinical handbook, the guideline, for instance, and then you could touch on the these arrows to see some more. As I mentioned earlier, we are the WHO guidelines that was published in 2006 is currently being updated and expanded. So this is something that we're working on. For monitoring and evaluation, we are developing a measurement guide on FGM for health sector, and this is really important for those interested in recording, in having indicators, what to measure and how to measure it. We are also finalizing a CAP, a knowledge, attitude, and practice questionnaire that could be used for healthcare providers working in FGM prevalent settings. And this could be used for evaluation purposes if you want to know what the knowledge, their attitudes and practices are, sort of like a baseline so that you can develop the training content and also monitor over time if people are changing their behaviors or rather their attitudes and their knowledge, if it's changing over time. And we're also in the process of finalizing guiding templates for conducting situational assessment and developing national action plans. So in summary, WHO has a lot of resources out there, and you can access them through the resource kit that I've shown you. It really brings it all together nicely, or through the links that I've shared. And these resources are for everybody, ranging from health policymakers to program planners, managers, healthcare providers themselves, clinicians, educators, those working in professional associations, civil society, researchers, and monitoring and evaluation officers. So really have a look at the links, see what you think is relevant, and go ahead and use it. Thank you for listening.